Hey guys, welcome back to another weekend in my life working as a nurse. This weekend we got some COVID patients we're taking care of. We're going to be doing some baby baths. We're going to be taking care of these mamas, and we're going to be floated to labor and delivery where we're going to be laboring these mamas and having some really cute babies. So if you guys are interested in watching, stay tuned. Hello guys, sorry for the bad lighting. Good morning everybody. It is 6:10 in the morning. I am on my way to work for a shift. If you guys watched my previous vlog, I just finished my last final, which is amazing. I'm so excited. Oh my gosh, there's somebody pushing a car right now. Like, what is happening? Last night I got a call from my night shift team leader that I'm being floated to labor and delivery today, and she was like, are you comfortable with going there? Because it's been like a couple of months since you've been there, since I've been in school. So I said I felt totally comfortable, so I'm just wearing my regular clothes because I have to change into the hospital scrubs to be in labor and delivery, the OR like light blue scrubs. So I am stopping by Starbucks because I was going to get a coffee. We have like a McDonald's at the hospital, which is kind of weird to have a McDonald's at a hospital, but I usually get coffee there and this is really good. I don't know if I'm gonna have enough time because in labor and delivery, literally anything can happen. So I'm just stopping by Starbucks really quick. I think I'm gonna get an oatmeal as well, just to kind of wake me up because I only got 5 hours of sleep last night. I drove straight here after my final on Friday. Today is Saturday morning. Let's get some coffee and head to our shift, guys. Breakfast sandwich instead of the oatmeal. My iced coffee, even though it's cold. Okay, I'm here. Let me change into my yoga pants really quick. So when we are going to labor and delivery, we have to go to the scrub machine to get our OR scrubs in case we have to run to the OR for an emergency C-section. And fun fact, my hand slipped while I was recording this and I totally lost my scrub credit. So I had to borrow someone else's scrub credit to grab some scrubs. So after this, we just usually change, and it's just to prevent infection as well. So we're not bringing everything that we have on our scrubs home. So ready for our shift. So let's get a report on our patient, guys. In room 1, we have Miss Smith. She is 25 years old and she came in with her water broken. She is 38 and 5 days. She's a Gravida 3, Para 2. She has no known drug allergies. She's on a clear liquid diet. She's up ad lib. Her doctor is Dr. Jones and she is on the OB team. Her only medical history is asthma and 2 prior SVDs. She has a right AC IV with LR going at 125. Her blood type is O positive. She is current on her flu and Tdap. Her hemoglobin and hematocrit or H&H is 11 and 30. Platelets are at 200. She's negative in all her infectious diseases, rubella immune, and GBS negative. So far, she's been unmedicated, and she is currently dilated to a 6, 100%, and -2. So hopefully she will have her baby soon for you. So let me tour you guys around our triage room or exam room where a patient comes whenever she is getting triage or laboring. We always have a gown and blanket and towel on the bed. So we have EKG monitors in case we need to hook them up. We have trays, oxygen, and this is just in case they are really about to deliver. We have a precip kit or a precipitous delivery kit. There's like cord clamps in there. We have plenty of sutures of different kinds depending on the doctor's preference. This one is chromic gut. We also have Vicryl if they prefer. It all just depends on the doctor. And underneath we have a locked box of sterile instruments in case we need it, like scissors or things to suture with. We have a baby scale right here in case the baby needs to be immediately weighed. We can also weigh Chuck's pads that have lots of blood on it in case the mom hemorrhages. And right here we put our sterile instruments away and bring them down to sterile processing to get cleaned. We have a computer for charting right here, and we have more trays, trash cans, and in these drawers we have lots of extra stuff like gauze pads, flushes, band-aids, sterile gloves to check the patient, or just do some suturing if the doctors need it. And in here we have some stuff for like pap smears in case the patient just needs to be examined, and just some instruments and tools that are all locked away. Right here we have a lockbox of extra sterile instruments if we need it, and down below we have more stuff for pap smears. There's gowns, pads, underwear, some suction bulbs for the baby, just some extra stuff for mom and baby in case we need it. And up there we just have more equipment that's all locked away in case we need it. And up here we have this really cool headlight or spotlight that's really bright in case we need it for exams, or if the mom's delivering or the doctor needs to see to stitch and suture up mama. We have a nice spotlight right there in case we need it as well. So update, I had a baby in the first 15 minutes, so it was crazy. I had to learn everything really fast, how to redo everything. But now it's about 11 o'clock. I'm gonna grab a wrap and finish up some charting. I have a new patient. Sorry, somebody totally came in whenever I was on the stairs, and I can't talk when someone's right there, but I have another patient now. We're definitely gonna have a baby soon, but I'm gonna eat really quick because it takes a while to do the recovery. It takes a while to get everything all set up and her cleaned up and everything, so I'm gonna eat lunch really quick, and then hopefully we'll have a baby soon.
Don't at all work in that department.
Yeah.
Yeah.
After lunch, we had a baby, and the rest of my day just consisted of getting medications to recover mama from the pyxis. And after mama's recovered for 2 hours, we go to postpartum, where they rest and recover for the next 24 to 48 hours. Okay, well, that was a crazy shift. 2 deliveries, and an admit right at shift change, so that was fun. But yeah, I'm gonna go, I just got changed. I'm gonna go meet up with my friends and have a nice dinner, and I'm back at it tomorrow. I actually just had, I think it's called Einstein Bros. Yeah, Einstein Bros bagels. I came here yesterday for the first time ever yesterday just because a bagel sounded so good, and it was the most amazing bagel I've ever had, and I've never had it before, so I'm grabbing some with a cold brew right before work. It's like 40 degrees outside, but if you are one of those people who just drink cold drinks, cold coffee throughout the winter, like this video right now. I've never tried their cold brew, but if you haven't tried Einstein Bros, go to Einstein Bros and try the French toast bagel with a strawberry schmear toasted. It will change your life. I'm here right on time. I ate my, oh my gosh, I'm sorry guys, there's no, it's still super dark out here. It's 6:36. I have my badge, I got my shoes and my little happy teeth. Oh, you guys can't see it, let me show you. Y'all, this cold brew, 10 out of 10. This is bomb. I got the cold brew with the vanilla cream, I think. It's like perfectly sweet. It's so good. Oh my gosh. I have my little Crocs in my little compartment, my shoe compartment, my happy teeth bag. So let me switch out shoes and head to work. It's freaking raining and it's freaking cold. So it's the next day and we have Miss Smith again, but she is a postpartum mom. As we know, she is 25 years old, and now she had a SVD yesterday at 10 a.m. And we know that she is 38 and 5 days. She's a Gravida 3, now Para 3 with no known drug allergies. She's on a general diet now. She's up ad lib, and we know that Dr. Jones is her doctor, and she's on the OB team. And remember her history of asthma, and now she has 3 SVDs. Her right ACIV is now saline locked. She is O positive, current on her flu and Tdap. Her post H&H after delivery was 10 and 28. Her platelets are now 198. She is negative in all her infectious diseases. Rubella is immune, and she is GBS negative. Her QBL after delivery was 350 mils. And now we also are taking care of her little baby girl. Her APGARs were 9 and 9. Her ID band is 1, 2, 3, 4, 5, and her disc is 1. She is breastfeeding only. She's DAT negative. PKU, hearing screen, CHD are all done, and she passed. Her TCB or transcutaneous bilirubin will be at 1600 for you. Her birth weight was 3550 grams, and she will also need a bath this shift. Mom and baby are doing very well, and they've had no concerns at the time. You will have Motrin due at 9 and 1600, Tylenol due at 1300, and she has Colace PRN as a stool softener, and Norco for more severe pain if she needs it. You're gonna have a great day with her. So today I actually had a COVID mama, so I'm going to show you guys how I put on my PPE. This is my capper. It gives me positive ventilation into my face, so I do not have any airborne particles at all. I always have to wear a gown because it is droplet and contact precautions, and I have to double glove as well, and that is pretty much all I do every time before I enter her room. So as we got in report, we have to give a baby bath to our baby girl. I just get a basin and some baby shampoo and some towels. And as we talked about in report, we have a TCB or transcutaneous bilirubin reading at 1600. This little thing is just a non-invasive method for measuring the baby's bilirubin because bilirubin can make them very yellow and jaundiced, as you guys probably have seen in clinical. It's just a little light that doesn't hurt the baby. You just press it on their forehead or a hard surface on their body 3 times, and it says error here because I'm just doing this little wall. But our baby's TCB was great, and now I'm just going to chart everything we did all day long, which takes a while, and afterwards we clock out, and that's it. See you guys in the next video.